Hello dear nursing aspirants, welcome to Ganesh Nursing Academy. Today I am going to discuss some of the important MCQs on cardiopulmonary resuscitations. So these questions are going to help you in your competitive examinations. So all of you carefully listen to today's session, okay, and make a benefit of it. So without wasting time, let's see today's session, that is a important MCQs discussion on cardiopulmonary resuscitation. Let us see the first question. What is the first step you should take if you see someone collapsed? Okay, when you see someone collapsed, what is the first step you will take? Okay, option A, start chest compression. Option B, check for breathing. Option C, call emergency services. Option D, check the scene safety. Okay, see, whenever you see someone collapsed, never go directly, okay, and start with a cardiopulmonary resuscitation. Okay, so before you should start with the chest compression, okay, so what you have to see is you have to do the check for the scene safety. Okay, you have to check for the scene safety, whether the person who has collapsed should be whether he is in a safe situation. Okay, whether he is in a safe scene. If he is not in a safe scene, for example, sometimes someone may be collapsed, he may be still connected with some electrical wire, or there may be some dangerous may be associated with the scene. Okay, if you directly dive into the scene and start chest compression, there is a threat to your life. So that is the reason why first and foremost you have to check for the scene safety and bring the patient or the victim into the safe place, and then we can start with the steps of BLS or a cardiopulmonary resuscitation. Okay, so what is the right answer here? It is a option D, that is a check the scene safety. So what is the first step you should take when you see someone collapse? That is the first and foremost is we have to check the scene safety. Okay, check the scene for the safety. Now let us see next question. What is the first step in BLS or a cardiopulmonary resuscitation? What is the first step in BLS or cardiopulmonary resuscitations sequences? Okay, option A, start chest compression. Option B, check pulse. Option C, check responsiveness and call for help. Option D, give rescue breath. Okay, so whenever any person fall collapsed, okay, the first step of BLS or the first step of cardiopulmonary resuscitation is you have to check for the consciousness. Okay, you have to check the responsiveness. Okay, so you have to tap onto the patient's shoulder or the victim's shoulder and ask, are you all right, are you all right? If person does not respond to you, then immediately you have to call for the help. Okay, this is the first step. Okay, if person does not respond, immediately you have to call for help, and then you will go for the checking the carotid pulse. Then after that you will start chest compression, then start giving the rescue breath. Okay, so this is the sequence of the cardiopulmonary resuscitation. So the first step in BLS or the cardiopulmonary resuscitation sequence is, first you have to check the responsiveness. Okay, by how? By tapping onto the shoulder of the patient, calling. If patient does not respond to your stimulus, then you have to call for the help. This is the first step. Let's see next question, that is, which artery is used to check pulse in an unresponsive adult? Okay, so when you tap onto the shoulder of the patients or the victim, and if it does not respond, okay, so when which after that, which artery is used to check the pulse in an unresponsive patient? Okay, so patient is not respond, even if you when you tap onto the shoulder of the patient, if it do not respond, the next step would be you have to check the pulsation. You have to check for the pulse, and which artery is used? It is a not brachial artery. Okay, it's not a radial artery, it's a carotid artery. Okay, you need to check the carotid artery, not the femoral artery. So carotid artery is one of the closest artery to the heart. Okay, if carotid artery pulsation is absent, that means the pulse is absent all over the other pulses over the body. Okay, peripheral pulses. Okay, so that is the reason why we will check the carotid pulse. Okay, carotid pulse is present at the around the trachea. Okay, in the lateral groove of the trachea. Okay, so there you have to just use your three fingers and you have to feel the carotid pulsation. Okay, and you should not take more than 10 seconds. Okay, so when you check the carotid pulse, you should not take more than 10 seconds. Within 10 seconds you have to find out whether carotid pulsation is present or absent. Okay, so which artery is used to check the pulse in a unresponsive adult? It is a carotid pulse. Okay, and time taken to assess the carotid pulse should not be should not be more than 10 seconds. Within 10 seconds you have to assess the carotid pulsation. Next question, what is the correct hand placement? What is the correct hand placement for adult chest compression during CPR. Okay, so when you are performing a adult chest compression, when you are performing a CPR to an adult persons, okay, how to place the hand? Okay, so what is the correct hand placement for adult chest compression during the chest compression? Option A, two fingers in the center of the chest. It's wrong. Next, one hand on the lower abdomen. Okay, we will not compress on the lower abdomen. It is a chest compressions, so it is wrong option here. Next, option C, heel on one hand. Okay, heel of one hand on the lower half of sternum. See here, this is the one. Okay, the heel of one hand, the heel of one hand over the lower half, over the lower half of the sternum, and other on top of this one. Okay, so other hand is placed on the top of this hand. Okay, so this is exactly the technique of holding the hand. Okay, placing the hand on the chest sternum of the patients. Okay, in order to initiate the chest compression. Okay, so the heel of one hand, you can see this is the heel of one hand. Okay, heel of one hand on the lower half of the sternum. Okay, lower like half of the sternum, the heel of one hand is placed, and then on top of this hand another hand is placed. Okay, and finger should be interlocked. See here, finger should be interlocked and elbow should be locked. Elbow should not be bent, elbow should be locked. So this is the correct hand techniques. Okay, both hand on the rib cage, it is also wrong option here. So option C, that is heel of one hand on the lower half of the sternum and other hand on top, that is a correct option here. That is option C is a correct answer here. Next question, what is the depth of chest compressions for a adult CPR? Okay, so what is the depth, how much depth we need to do the chest compression for adult, for when you do a chest compression, when you do a cardiopulmonary resuscitation on the adult? Okay, so what is the depth of chest compression for an adult during the CPR, cardiopulmonary resuscitation? Okay, option A, at least 1 inch, option B 1.5 inch, option C 2 inch, option D more than 3 inch. Okay, so it is option C is correct here. So when you do a chest compression, make sure that at least 2 inch of the chest has to be compressed. Okay, the chest has to be compressed at least 2 inch or a 5 centimeter. Okay, so what is the depth of chest compression? How much depth you compress the chest? That is at least 2 inch or a 5 centimeter for the adult. When you do a chest compression to the adult, at least the 2 inch or a 5 centimeter, the chest has to be compressed. The chest has to be depth of the chest compression should be at least 2 inch or a 5 centimeter. So option C is the correct answer here. Next question, why is allowing full chest recoil is important during the chest compression? Okay, option A, it speed up the chest compression. Option B, it prevents rib fracture. Option C, it allow the heart to refill with the blood. Option D, it improve the ventilation. Okay, see here, whenever you do chest compressions, we have to allow the chest to recoil. Allow the chest to recoil means you have to make the chest again come back to its position. Okay, so when you do the compressions, okay, it will go depth like 2 inches in depth it will go. Then we have to make the chest come back again its position. Okay, this is known as allowing the chest to recoil. Okay, why we are allowing the chest to recoil? So that during the when you allow the chest to recoil, what happens here? The heart is filled with, okay, the heart is located in the below the chest. No, so we are just allowing the heart to fill with the blood. Okay, we are allowing the heart to refill with the blood. Okay, so that is the reason why we have to allow. Okay, so we have to allow the chest to recoil completely during the chest compression. So that is the reason why we use like 101, 102, okay, 103, 104. Okay, we will count like this when we give chest compression, so that we give adequate spacing between the chest compression, so that we will allow the chest to recoil and heart to fill with the blood. Okay, so what is the main purpose of allowing the chest to recoil is to allow the heart. Okay, we need to allow the heart to refill with the blood. Okay, so that is the reason why the counting of chest compression, counting to the chest compression should be 101, 101 and 102 and 103 and 104, or you can say 1 and 2 and 3 and 4. Okay, so just we are spacing the chest compression and allowing the chest to recoil and allowing the heart to fill with the blood. Okay, once the heart is filled with the blood, if you give chest compression, then blood will go for the perfusion, and there is a perfusion of blood to the myocardial cell itself, or the perfusion to the vital organs can be maintained by allowing the heart allowing the chest to recoil. Okay, so this is a major advantages of allowing the chest to recoil during the chest compression. So the answer for this one is, okay, so why is allowing a full chest recoil is important during chest compression? It allows the heart to fill with the blood. So I hope this concept is clear. Next question we will see, minimizing interruption in chest compression is important. Okay, so when you do high quality chest compression, minimizing the interruption, minimizing the person who is performing the chest compression is very important. Okay, we should not disturb, or we should not do the interruption to the person who is performing the chest compression. So what is the why it is so important? So minimizing interruption, okay, in chest compression is important because it helps the rescue to stay rhythm. No, it's wrong option here. It keeps the victim conscious. No, conscious victim is not conscious actually during the cardiac arrest. It increases the coronary perfusion pressure. Yes, this is the correct option here. So when we minimize the interruption during the chest compressions, it maintains the coronary perfusion pressure, and thereby it increases the myocardial tissue perfusion. It increases what? A myocardial tissue perfusion. Myocardial tissue perfusion. Okay, so that is the reason why we just should not, okay, so we should not interrupt the person who is giving the chest compression. Okay, we have to minimize the person who is giving the chest compression. So minimizing the interruption in chest compression, it is important to as it increases the coronary perfusion pressure and it increases the myocardial tissue perfusion. Okay, when myocardial tissue perfusion increases, what happens? Automatically the heart will start contracting by itself, and thereby patient hemodynamic stability can be improved. Okay, so option D, it gives time to check pulse. It's the wrong option here. Okay. Next question, question number 8. The compression rate during the CPR. The compression rate during CPR for all age group is, okay. So what happens here when you do chest compression for adult? What is the compression rate? Either it may be neonatal resuscitation or the main adult chest compression. Okay. So the rate should be 100 to 120 per minute. Okay. The rate of chest compression. It is a rate of chest compression. So rate of chest compression should be, what happens here? It should be 100 to 120 per minute. Okay, so the compression rate during the cardiopulmonary resuscitation for all ages group is 100 to 120 per minute. Okay, option A is wrong here, option B is wrong, option D is also wrong. It is a 100 to 120 per minute. Okay, so this much at this speed the chest compression should be delivered to the patients, so that we should maintain adequate myocardial tissue perfusion. Okay, so that is the reason why it is adequately maintained. Next question, what is the correct compression? What is the correct compression to ventilation ratio for adult CPR when there is only one rescue? Okay, so compression, ventilation. Okay, so this is the compression, that is chest compression, and ratio, that is ventilation. Okay, ventilation. So when only one rescuer is there, okay. So in this condition, what happens here? The compression should be 30 compression, okay, and 2 rescue breaths should be given. Okay, when we have only one rescuer. Okay, for example, only one person is performing a cardiopulmonary resuscitations, so he has to give 30 chest compressions, and then he has to go to ventilation. Rescue breath has to be given. Okay, so when 2 rescuers are there, okay, so in this condition, what you do? 15 is to 2. Okay, 15 chest compression and 2 ventilation has to be given. Okay, so in case of 2 rescuer, 15 is to 2. Okay, in case of one rescuer, only 30 is to 2. Okay, ventilation compression has to be maintained. Okay, so compression means chest compressions, ventilation means 2 rescue breath. Okay, 2 rescue breath that has to be given. So if there is only one rescuer, there's one person is there who is performing the chest compression, 30 is to 2. Okay, so the one here they have mentioned in the question, so answer is 30 is to 2. If 2 rescuers are there for performing the chest compressions, then we can go for the 15 is to 2. Okay, so option B, 30 is to 2 is the correct answer here. Next question, which of the following is not a component of high quality chest compression? Okay, so first option is adequate depth. Okay, this is the correct option here. Okay, correct this one, it is one of the quality of high quality chest compression. Okay, the chest compression should be given in such a way that there should be adequate depth. Okay, the chest should be compressed at adequate depth, at least 2 inches. Okay, the chest should be depth okay, compressed at least 2 inch in depth, or a 5 centimeter, 2 inch or 5 centimeter depth it should go. And correct hand placement, this is also very important here. So whenever you do a chest compression, you should see that the hand placement should be correct. Okay, so that is the heel of one hand, okay, should be placed on the lower half of the sternum, and another hand should be placed over the that hand, and then finger should be interlocked and elbow should be locked. So that is a correct way of a hand position. That is also one of the component of high quality chest compression. allowing the next option C, allowing partial chest recall. This is a wrong option here. Okay, so we have to allow the complete chest recall, not partial here. It is not partial here. We have to allow the chest for a complete recall. It's not partial recall. So this is the correct answer here. This is the correct answer, which is not. They asked which of the following is not a component of high quality chest compression. They ask. So it is nothing but, okay, it is nothing but a option C. Option C is not a component of a. It is not a component of high quality chest compression. Okay, next option D is minimizing the interruption. This is also very important here. We have to minimize the interruption. We should not interrupt the person who is giving a chest compression, and chest compression rate should be, it is 100 to 120 okay, chest compression per minute it should be given. Okay, so which of the following is not a component of high quality chest compression? It is option C, that is allowing the partial chest recoil is not correct answer here. Okay, one of the component of high quality chest compression is allowing the complete chest recoil is one of the component of a high quality chest compression. Okay, next question, during the CPR, when should chest compression is paused? Okay, so a person, take an example, a person who is giving a chest compression continuously, when he is supposed to pause or stop the chest compression? Okay, every 30 seconds, wrong answer here. Only when giving breeze or a AED. Okay, this is the correct answer here. Whenever you do a chest compression to a person, you should pause or stop chest compression only when you give a rescue breath, that is mouth to mouth breath, or whenever we deliver the, okay, automated external defibrillation. At that time only we have to pause, and then once we give rescue breath or automated electrical external defibrillation, then again we have to immediately begin with the chest compression. Okay, after every minutes, it's a wrong option here. After every minutes we should not stop chest compression. Every time the rescuer feel tired, okay, no, it's not wrong, it is a wrong option here. Whenever the rescuer feel tired, he should not stop, he should call for the help. Okay, and the other person should be made engaged to give a chest compressions whenever he tired. Okay, but never stop the chest compression. The chest compression should be stopped or paused only when, okay, it is only stopped when we give a rescuer, give a rescue, okay, the rescuer give the rescue breathe. Okay, or whenever a person is giving with the victim is giving with the automated external refilter, at that time only we can stop the, okay, chest compressions. Okay, so with this we have completed the important MCQ discussion on cardiopulmonary resuscitation. So thank you very much for patient listening. I'll come up with the next video, that is what are the some of the important MCQs on neonatal resuscitations. I will discuss in the next video. So thank you very much for patient listening. We'll see in the next video. Thank you very much.